Hi, my name is Meredith Russell, and I'm a pediatric endocrine nurse practitioner at University of California, San Francisco. I provide care in pediatric endocrine clinics, and I also am nursing director for the Child and Adolescent Gender Center. I helped launch our Child and Adolescent Gender Center in 2012, and since then I've served as a medical provider and as a nurse in that clinic. I'm here to talk about transgender and gender diverse youth, approaches to evaluating gender dysphoria and promoting gender affirmative healthcare. Some objectives I have are for you to understand the barriers to accessing gender affirmative care, and then learn how to evaluate gender dysphoria when clients come into clinic, and identify strategies to reduce distress and provide a gender affirmative environment.
What is gender dysphoria?
So it's a mental health diagnosis that's outlined in the DSM-5, and it's a diagnosis related to the distress between the incongruence between one's internal sense of gender identity, and the assigned sex at birth. Related to this is body dysphoria. Body dysphoria is the distress between the incongruence between one's gender identity and the primary and secondary sexual characteristics. The primary characteristics are those ones that you're born with, and the secondary sexual characteristics are the ones that occur at puberty.
How does the environment surrounding a young person impact their sense of gender dysphoria?
Gender dysphoria is related to interactions between the child and their environment. So we know that lack of support in the environment can increase or even cause gender dysphoria. This can come from interactions of the child or adolescent with their home environment, their caregivers, their extended family. It can relate to their school environment or the experiences that they have when they go to the clinic or hospital. Children and caregivers bring these experiences relating gender with them. So it's important to know that there's a whole history behind that they're bringing with them to clinic, and that it's very, very important as a provider to assess for what those experiences might have been, and then provide a more affirming experience to build trust.
How might the barriers to care that patients and caregivers have faced impact your ability to establish trust?
There are many barriers to gender affirmative care. One barrier is the challenge that families might have locating a gender provider. So parents and children might come to clinic already having searched for months or even longer for a provider who's interested and competent in providing gender care. So it's important to know that they might already come frustrated, and that you need to put their minds at ease that you're able to provide that care and that you understand that they're ready for it. Also, another barrier is the environment typically is built for binary cisgender clients. So for example, in most places that people are going to go, from restaurants to shopping areas, schools, workplaces, they're going to have restrooms that are going to be binary restrooms, women's restrooms, men's restrooms. And simply that can create a tremendous amount of stress for a young person who is identifying as transgender or gender diverse. They might also have experiences with misgendering. So they might have been interacting in other environments and people have used the incorrect name or pronoun. And adults in their life or kids might have been questioning the validity of their gender identity. So sort of saying things like, this is just a phase or a stage that you're going through, you're going to grow out of it, you don't know that this is for sure. Those kinds of things can be incredibly invalidating for a young person and very, very upsetting. And they might have had trauma from previous evaluations. Sometimes kids and parents have already accessed a mental health provider, for example, because the child experienced distress or depression or anxiety, and this may or may not be related to their gender identity. However, they might end up with a diagnosis of depression, anxiety, gender dysphoria, and that simply having that mental health diagnosis indicates that they have a disorder, and that can be incredibly unaffirming for a young person. Also, they might have had physical exams that were very traumatic for them. So if they have body dysphoria, if they're uncomfortable with their genitalia or breast development or any other part of their body, and they've had to have physical exams, at their doctor's office or in other settings, then they might be very traumatized by that, and that they might come to clinic expecting to have further trauma.
Given some of the barriers they have faced, what should be considered when taking a patient's history?
As a provider, it's important to learn how to evaluate gender history. So when a young person comes in for the first time to clinic and you want to get to know a little bit about them, a good way to start is first establish trust and rapport. So I like to talk with young people about what their strengths are, their interests, what do they like to do at school, what are they interested in their free time. And then I slowly move into more personal questions relating to their gender identity, their sense of self. And it's a good idea to start with open-ended questions, which allows the young person to tell their own story. Tell me about your gender history. When did you start thinking about this? Has it stayed the same over time? Has it changed? How does it feel in terms of your body or any body changes that you've had? You want to find out about their pubertal history, because this could be relevant in terms of whether or not you would want to talk about offering gonadotropin-releasing hormone agonist medications, which are puberty blockers, and also whether or not that was upsetting for their body. Gender dysphoria symptoms. So when you're talking with a young person, you want to find out if they're having any problems with depression, in particular related to their gender, but they might have anxiety as well. And so asking questions about whether or not they're having a lot of sad feelings, whether or not they're having experiences at home or at school related to their gender that makes them feel unsupported or depressed is very important. And then whether or not there's any parts of their body that they might be uncomfortable with. So I ask some questions about that. So, when you first started breast development, how did that feel for you? How do you feel now about your breasts? Or similar to like hair development or genitalia. It's very important to understand where the young person is in that moment, how they're living in their body, so that you can try to figure out what would be the best way to support them. And most importantly, you want to find out what the young person's goals for gender expression are. So I usually ask questions like, in the best case scenario, how can I best support you? What are you looking for? Is it something that relates to social transition that I can talk about? Is it something related to non-pharmacological treatments? Is it something related to medications? Are there certain specific body changes that the young person is hoping for? That helps me understand how I can best support them. And definitely don't forget to listen. So I think it's tempting sometimes as a provider to ask closed-ended questions, gather your information, and then make a recommendation, provide your expertise to the family or the young person. However, if you don't remember to listen, then you don't really learn about the patient, and you don't establish trust, and you don't actually get all the information that you need in order to provide the best care.
What are some ways providers can make the physical exam more comfortable for their patients?
Next is to do a physical exam, but it's important for providers to remember that this can be an incredibly stressful experience. It's helpful if even before they come to the clinic for the first time that someone reach out and talk about what to expect in the clinic experience and explain to the young person that a physical exam will happen. However, they have a lot of choices, and we will do our very best to make them as comfortable as possible. So the first thing I do before I put hands on a young person is I establish trust by creating a gender-affirming environment, letting them know that I'm on their side. I want to get to know who they are, what their gender experience is, so that I can support them. And then I explain what a physical exam is. So it's interesting because as a provider, you have a very concrete idea of what a physical exam means, but for a young person, especially of different ages, they may not know what you're talking about. Does that mean that you're going to listen to my heart and lungs? Does that mean that you're going to look between my legs? So it's very, very important to remember to explain what a physical exam is, what are the different steps that will be happening, and then why. So if someone's coming to clinic and they're around the age of typical pubertal development, and the young person is very distressed about it, and they might be seeking puberty blocker medications, then it's very important to find out if they are in puberty. because if they're not in puberty, then the medication's not going to be useful. So I talk about what body parts I'd like to look at to evaluate for that. And, I ask permission. And sometimes kids have such strong body dysphoria when they first come, and we haven't had time to establish trust. And so sometimes on the first visit, I'll bring up pictures of stages of pubertal development, and I'll just talk about it. And I'll ask them, if they're comfortable enough, I'll say, where do you think your body is? And I'll get their input on how they think their body's changing. And then another way that I provide choices for the young person in terms of the physical exam is I ask them, when would you like me to do the physical exam, in particular, the genital exam or pubertal exam? Is it best to get it done in the beginning of the visit? Is this a young person who, wants to get it done as quickly as possible under a blanket or a gown, and they don't want a lot of talking or details? Or is this a person who wants to be guided through the process step by step with me explaining what I'm going to do before I do it? I always assess for what that individual wants, because people are different. And I want to make sure I do the exam in the best possible way for that young person. And I'll ask them, would you prefer that we do it at the end? And then maybe it's another visit. Maybe this is the first visit and they're not ready for that. And so I'll say, well, let's just talk about what puberty is today, and let's look at some pictures of stages of pubertal development. And then the next time you come in, I'd like to address this again, if that's okay, and find out if you're ready for the exam at that point. And sometimes that can just be a first step in establishing trust, rather than insisting that I do an exam that very day. And then oftentimes by doing that, it gives them a sense of control, and it lets them know that I respect their body and that they're in control of it. And then oftentimes when they come back for future visits, they're willing to let me do a physical exam. And of course, I make sure that they have privacy, that they have access to a gown or a blanket, anything that they would need to make them feel most comfortable.
How can I make sure that any necessary follow-ups are clear for my patients?
In terms of follow-up, after you've met with the client, it's important that you provide a clear roadmap to care. So, every clinic has different approaches, whether you're an informed consent clinic or you're a clinic that has very specific steps towards getting medications or procedures. It's important to have some kind of document in writing that explains the different steps. So, once you're ready for your puberty blocker or your hormone replacement therapy, estrogen or testosterone, these are the steps that this is the path that will lead you there. So for our clinic, part of that pathway involves, meeting with a mental health provider to get support. That person often will make sure that the young person is getting support for their gender identity and also evaluating for gender dysphoria so that we can best help them. And then, explaining that there might be some baseline labs that will be done, imaging, that medications will get ordered, and then we have to get prior authorization from the insurance before they can actually get the medication. So just not assuming that the young person or the parents or guardians understand that process is very important. And I think that by having some kind of plan, a roadmap, that this provides hope, and it reduces the tremendous amount of anxiety and frustration that clients might be bringing to clinic with them already. And then finally, as a gender provider, I always try to ask for feedback on a young person and guardian's experience. This helps me understand how I've interacted, and it helps me evolve over time and improve my practices and my communication so that I can provide the best possible care. So in summary, as a provider, when a family and a patient is coming to clinic for care, it's important for the provider to realize that they're bringing experiences with them in terms of their gender identity and the experience of their gender and their environment. So they might be coming already with tremendous anxiety regarding what's going to happen, or they might have had really bad experiences in other settings that have led them to be very anxious and unsure about what's going to happen. And so the provider needs to take some time to evaluate the gender dysphoria and body dysphoria and allow space for listening so that the young person and the guardians can tell their story and help the provider understand how best to support them.
Hi, Carlos here. To keep the conversation going, make sure you join the Gender Spectrum Lounge at genderspectrum.org/lounge. We hope to see you there.